Back to school sports are getting underway, and for student athletes, that means getting back into the game safely. Joining us now is Christopher Rancourt with the Toledo Clinic Sports Medicine to talk about preventing injuries, recognizing the warning signs, and making sure the athletes recover the right way. Thanks for being here today.
Yes, thank you, Amanda. Once we're now into the first week of the fall sports here, at least for the high school season, and what we're looking at is trying to avoid unnecessary injuries, whether we're looking to prepare, obviously recognizing injuries, as well as trying to prevent them and getting them back on the field safely.
Yeah, football, I know they started practices, or football games start in a couple of days. What types of injuries do you typically see this time of year?
I mean, typically we're seeing anything from your acute, ligament sprains, muscle strains, simple fractures, because we don't typically see anything surgical in our office. Okay. And also we're seeing a lot of repeat and overuse injuries. We typically see these at this time of the year when kids are coming off of not doing much over the summer, or if they're trying to get back into things, a little bit too quickly. And honestly, we see that a lot more when we see athletes go from like one particular level of competition and moving up. So we see that a lot with like the middle school kids going into high school, because it's a lot more increased intensity as well as duration of their practices and competition, as well as when we look on the other side of things, going from like house and rec league sports into travel sports as well.
Yeah, speaking of travel sports, I feel like our kids are getting into maybe the same sport. Maybe, say for instance, at baseball, if you're a pitcher, for instance, and you're throwing that ball a lot. Talk a little bit about some of those overuse injuries that you might see.
Yeah, so over the last few years, we are seeing a lot more overuse injuries in these athletes, because it seems like there's more of a drive for early specialization in sports. And what we really like to tell the kids and tell the parents and advocate for everybody is that, when you take an athlete and you put them in the same repetitive sports, you have more increased risk for injury. So we always like to have those kids, try other sports, just be kids, be outside, be playful, maybe try 4-H, try different activities, give yourself a little bit of a break, or just try a different sport that might, use other muscle groups to try to help recover in that process.
Break it up a little bit. And also with, as I mentioned, football starting to, I think concussions are things that we like to talk about as well. We know it's a contact sport and the kids are hitting each other, What should families look for, athletes and parents look for in terms of maybe symptoms?
Yeah, so I mean, concussions, they've gotten a lot of publicity in the last few years, with the ongoing things with professional and college athletes, but the biggest thing is that concussions don't always have to be severe or significant, as some people may say. It doesn't require a loss of consciousness, but the main big symptoms you look for is obviously having a mechanism of injury, as well as having your big symptoms, including dizziness, headache, sensitivity to light and noise, confusion, as far as even drowsiness or just a lack of behavior. Okay. There are big changes in behavior that we've seen.
Got to keep a close eye on those kiddos. Now, if we notice, hey, something's not right, how do we recover, rest appropriately? How do we know how to do that?
That's a funny question. It's kind of person to person. Sure. If we look at head injuries, we can talk about that in a totally different aspect, but a big proponent to try to prevent a lot of these injuries is adequate rest. When we look at it from a big perspective, is that rest is most, if not more important than the actual training itself. And I think we'll talk about it here in a few minutes, is like the having hydration, as well as adequate nutrition and rest and recovery from a sleeping aspect as well.
Yeah, I was going to say, it's hot out there, so we need to make sure those water bottles are getting filled up. We know out on the field, coaches and everybody are taking those water breaks, things like that. I want to mention you have an event coming up that people can come out to.
Yes, so the Toledo Clinic, we are celebrating our 100th year this year, so we are having the Centennial Health Fair this Saturday up at our main Toledo Clinic campus up on Secor. I believe it runs from 9 to 1. There's free health screenings, there's going to be blood pressure checks, other resources for nutrition and things like that. And they're also offering, I believe, like a free introductory yoga courses throughout that day there. There's going to be food trucks and vendors. There's going to be a lot of stuff for both the kids and the family. And it's a good way to kind of bring everybody together to celebrate this big this big event for the Toledo Clinic.
100 years, that's a big deal. This Saturday as well, so it's good timing with back to school.
Yes.
Everybody's getting back into those routines, and we want to start things off on the right foot and a nice healthy start to new year, new sports seasons, all that good stuff. So thanks for being here today. We
Yes,
appreciate
thank you very much, Amanda. I appreciate it.
Absolutely.